excess skin. What happens after dramatic weight loss? We'll explain some of the available options. Welcome back to Good Morning America Health, everyone. I'm Dan Kleffler. Dramatic weight loss, where people lose more than just a few pounds and drop several sizes, can bring on an unexpected problem, all the excess skin. And it's not just a problem for celebrities like Kirstie Alley. She's been pretty open, in fact, about talking about the issue. So here to tell us about some of the procedures that can alleviate this problem is plastic surgeon Dr. Elie Levine. Dr. Levine, thanks for joining us today.
Thank you for having me.
Okay, so dramatic weight loss, we're talking more than 20, 30 pounds. A significant number.
Correct. We're talking about people losing anywhere from 100 pounds to 300 pounds, so dramatically changing the way they look.
Okay, and that can be either naturally or surgically?
So that can be done through diet and exercise or weight loss procedures. There are many bariatric procedures available today, or a combination of both.
Usually losing that significant amount of weight, that's the major hurdle that a lot of people think about.
Absolutely, and those are the kind of procedures that change, that get rid of medical problems like diabetes and heart disease and all kinds of issues that affect your overall longevity. But at the end of the day, they're still left with considerable amount of excess skin.
So there are health effects that you have to consider once you have lost all that weight. What are some of those concerns?
Well, people will develop rashes or infections along the excess skin folds. They also are limited in the amount of exercise that they can do, and sometimes it can even impair their ability to do their job. If they're a preschool teacher and they're running around after children, that extra skin really gets in the way. And of course, you can't discount the significance of even after you've lost all that weight, you still may not fit into the clothing you really want to.
When you're talking about excess skin, I mean, not just like a half an inch. I mean, there's a significant amount. I would imagine if you do lose 100 pounds, there is a lot there.
There are times where I remove 30 to 40 pounds of skin. And when you talk about that amount of skin, we're talking about huge segments of skin.
Wow.
Yeah.
So even more weight loss having these kinds of procedures done.
Correct. And the best example is I had a patient recently came in and she had lost her weight and she was actually at her ideal body weight and she was still wearing size 16 dresses. And after doing one of these procedures to remove a lot of the excess skin, she started wearing size 6 clothing. And it wasn't about what she weighed on the scale.
From 16 to 6? Just from
where the skin lies, because she wasn't able to wear anything around her midsection because of all those extra folds of skin.
What are some of the options then you can have?
So it's basically from head to toe, and it varies from patient to patient, and it varies based on your age and how much weight you lost and your baseline genetics from your mom and dad and what you come from. Mm-hmm. From head to toe, you can do a neck lift, because people develop a lot of neck excess around here. Breast lift is a common procedure performed. An arm lift for excess skin around there. There's a procedure called a body lift where I'm removing skin both from the stomach area, the hips, and the backside. And that's one procedure, and that's probably the foundation procedure of all of these. Mm-hmm. And then there's a thigh lift, and there are combinations of other smaller procedures that can be integrated, like liposuction.
Okay. In addition, okay. So what is the most common then? Would you say is the core area? Then that's
the core area is probably the most commonly requested procedure because it really sets a foundation for the rest of the body. It helps shape the waist and gets rid of excess skin and hanging skin along the belly area and lifts up the thighs, and is also a kind of a butt lift procedure. So it sets a foundation for the rest of the procedures.
I would have thought that a lot of times the skin would just start to shrink back in because the elasticity of it.
And it does. Some of it does shrink down. So if you're talking about someone losing 10 to 20 pounds, they're not left with a lot of extra skin. Most of that tightens down. But if someone goes from weighing 400 pounds to 200 pounds, a segment of that tightens, but the majority of it is still excess and still needs to be removed in one way or another.
And so, I mean, is there a length of time that someone should wait to see if it is going to kind of go back in or contract?
Most definitely. But you're looking to see how much it will contract on its own, because if you don't need the use of a plastic surgeon, well great, all the power to you. But at the same time, there's also a matter of health issues with regard to healing from the surgery. So generally you want to wait at least a year and a half after, if you're doing a bariatric procedure, to wait to do this. And you also want to wait at least 6 months of where you're stable at the weight where you want to be. So you don't want to be fluctuating a lot prior to doing the procedure. You want to be weight stable for about 6 months, and and then it's a smart time to proceed with one of these kind of procedures.
Obviously, with any kind of an operation, there is a risk. There's the potential for it. Are there any additional risks, though, from removing excess skin with these kinds of procedures?
No, I mean, there really aren't. The key to any procedure is, and you're right, there are risks with anything, is making sure that you're at your optimal health beforehand. So sending you to your primary care doctor or your cardiologist to run a battery of tests and make sure you're nutritionally sound and everything else is fine with you is a smart way to do this kind of procedure. It's not the kind of procedure where you come in on a Monday and do the surgery on a Friday. It's one of those things where you really want to prepare for to make sure that it's the right thing for you at the right time.
Have you had patients that have been shocked by the results after they've had the excess skin removed?
Without question, they are my happiest patients.
Really?
You can just see that their quality of life has improved afterwards.
And there's no scarring. There's no significant visibility.
So there is scarring. There's no question there's scarring. There's big scarring. The key to the operation of these procedures is hiding those scars. So, for example, when you talk about doing a body lift where the scar actually runs all the way around from front to back, it's hiding it low in the bikini area so that people can still wear a two-piece bathing suit. When you're doing breast surgeries, it's hiding it underneath the bathing suit as well, so that the scars are camouflaged and hidden. And while you know they're there, no one else in the world knows that they're there.
Wow, that's amazing. You know, for people that lose that much weight, whether it be bariatric procedures or by diet and exercise, it's another hurdle to overcome, but at the same time, though, the results seem to be well worth it.
It is. It's life-changing.
All right, Dr. Levine, thank you so much. Great information today.